Tuesday, December 8, 2020. Welcome to the online ART training in Module 1B on Sperm Morphology. It is 9 a.m. Eastern Standard Time. My name is Ashok Agarwal, and I'm going to be your host for the next 2 hours. We are here in Cleveland Clinic in Cleveland, Ohio, United States. Just a very short introduction to myself. I am the head of Andrology Laboratory at the Cleveland Clinic Foundation in Cleveland, Ohio for past 28 years. I'm also the director of the American Center for Reproductive Medicine. I'm a staff in urology at Cleveland Clinic. And I'm very proud that our team is rated as #1 in the world in the fields of male infertility, andrology, and human-assisted reproduction. This is based on the number of peer-reviewed publications, citation scores of people who are using our articles into their own publications, and an H-index. These together can be searched by anybody in any part of the world using Scopus. We have a large number of books in the area of human reproduction, and many more books are going to be coming in. And our laboratory has trained a very large number of scientists, clinicians, and graduates and undergraduates from the United States and more than 85 countries. So with these words, I want to welcome all of you who are attending the program. We are expecting a number of about 1,400, some numbers, and I think you will see in the slide who have registered. The capacity of WebEx platform, which is being used to air this program and reach out to all of you, is 1,000. Those who are not able to get in and who join a little bit late will be able to see this program live via the streaming link which has been provided on the WhatsApp. For declaration, the organizers and the speakers have no conflict of interest. No companies or outside entities were contacted for sponsorship. The program was made entirely possible by support from the Cleveland Clinic. Webcasting was supported by our colleagues David Reichling and David Wolfley from IT, who have generously supported our program last month as well. The course faculty have generously donated their time for this online training and have spent pretty much the entire 1 month preparing for this course, as you will hear. Program coordinators, we have a fantastic team of 9 coordinators from all different parts of the world who have generously donated a large amount of their time on a day-to-day basis for this training. The names, images, and description of certain products or instruments shown or discussed during the lectures in today's presentation are being used routinely by us in the Andrology lab. These items are not endorsed by any of us as speakers. So let's talk very briefly. The learning objectives of today's module is to develop an understanding of sperm morphology by WHO 5th edition, understand the staining protocol used in the laboratory, learn the use of strict criteria classification, understand the external quality control in sperm morphology, learn about, and there are many troubleshooting tips that we are going to take. The next speaker is Dr. Sajal Gupta. The next speaker is Dr. Sajal Gupta. Dr. Gupta is the technical supervisor of our center in Cleveland Clinic, Andrology Center, for a number of years. She's a very young woman, so I wouldn't want to tell you how long. And she was not happy with one fellowship, so she did two of them, as you can see. But more importantly, she has been received many awards. She is also active besides her clinical duties on the research and has published a large number of papers. She is an assistant professor in the Cleveland Clinic Lerner College of Medicine, and she will be speaking on, let's go to the next. She will be speaking today on sperm morphology, step-by-step protocol. So she is going to walk us through the every little step that needs to be taken towards conducting the sperm morphological preparation of a smear and staining and scoring. So Sajal, you can begin.
Thank you very much, Dr. Agarwal, for a nice introduction. And thanks to Dr. Henkel for an excellent presentation. And he highlighted why it is extremely important to do correct sperm morphology. And correct sperm morphology can only be done by following standardized procedures. So my presentation is going to be on sperm morphology step-by-step protocol. And basically, I'll be presenting to you the standardized protocol for doing sperm morphology assessment. Next slide. Next. The learning objectives of my presentation are introduction to sperm morphology evaluation, preparation of the morphology smears, the staining methods, and what are the tips that can optimize smear preparation, staining, and sperm assessment. Next slide. So morphology assessment reflects, when it is done with bright field optical microscopy, that there is a very heterogeneous sperm morphological forms which result from spermiogenesis. So spermiogenesis is the process where the round spermatid will transform into the beautiful long sperm with the head, midpiece, and the neck. And when we look under the microscope, we find a variety of different morphological abnormalities in a sample, which is a native semen sample. On the other hand, if we look at sperm, which is retrieved from the female reproductive tract, either in the cervical canal, when post-coital cervical mucus is aspirated to look at the spermatozoa, or from the uterine cavity. And on the right side, you see an oocyte with the sperm, which is attached on the zona pellucida. And these sperm are basically also called zona pellucida preferred or zona pellucida selected sperm. So when these spermatozoa were stained, there was a predominance of normal spermatozoa, and this sample of spermatozoa was much more homogeneous compared to what is seen in the native sample. So this is where the strict criteria originates, and this is how strict criteria defines sperm morphology only into normal and abnormal forms. Next slide, please. So sperm morphology involves a series of steps, and the first step here is smear preparation. And on the right side, I've provided an example of a technologist in a lab who's working on a semen sample. So essentially, the steps are listed, and the most important step is to always vortex the semen sample for 10 seconds, making sure that the sample aliquot is representative and there's no heterogeneity introduced into morphology assessment because you had an incompletely mixed sample. The smears are prepared in duplicate, and before removing the second aliquot, make sure you always vortex the sample again. And the smearing technique, I will provide some of the examples where it will be different from just using a normal neat semen sample. Next slide. So the smear preparation is done by feathering technique, and clean frosted slides are used, as you can see on the image on the right side. They are labeled with the patient identifiers. You apply a 10 microliter droplet or a 20 microliter if the sample is more concentrated. And the second slide on the top, you can see, is basically used to pull the drop of the semen along the surface of the slide. And as a result, you obtain a uniform feather-like thin smear. And the second image shows the wrong technique. So it is labeled with a red cross. Never push the droplet. It is always a pull-through technique and done at an angle of 45 degrees within a second. Next slide. So this I'm going to show a practical demonstration. We have the slides labeled here, the frosted slides and the slide to make the smear. So the water sink is done, then the 10 microliter droplet, it's aspirated, it's placed upon the slide at the frosted end, and then the other slide is taken, the plain slide, to make the smear. And this will show you the technique. It is used at 45-degree angle. Within a second, a thin smear is prepared, and a second smear is prepared again to have two duplicate smears for one sample, because we will do the replicate measurement. Here I have shown that in cases where the sperm concentration are low, for example, if the sperm concentration is 2 million, then we need to concentrate the sample. And this is achieved by centrifugation, the speed and the time is given. And then on the right side, it's shown that the supernatant is all aspirated, only 100 microliter of the sample supernatant is left. And this is used to reconstitute the pellet, which is at the bottom, and make sure that you do not concentrate more than 50 million. So that is the ideal concentration with which you can use a 10 microliter droplet. And again, make the smears with the concentrated sample, but do make a note on the sheet, on the worksheet, that this was a centrifuge sample. Next slide. So here is the steps of the staining protocol. The first is the stain that we use. It's a diff quick stain. The right side shows the kit we have, fixative staining solution 1 and 2. Staining solution 1 has the eosinophilic xanthine. The staining solution 2 has basophilic thiazine. And on the top, I provided an example of a nice smear with, using the diff quick stain. Next slide. So here is the details of the staining protocol. Once the smear is prepared and is air dried, then the first step is, and we have the working solutions on the right side. The first is the fixative. So you have to fix the slide, dip it in the fixative for 5 times, 10 seconds each, and then again air dry the slide. And once the slide is fixed, then it has to be sequentially immersed in the diff quick staining solutions. So for staining solution 1, it's 3 dips for 10 seconds each. And for staining solution 2, it's 5 dips. And then quickly rinse in the water. So here on the slide right, we have an air dried slide, which will be first fixed in the fixative. So it's pulled up and then dipped in the fixative. It has to be a slow dip of 10 seconds each, making sure all of the slide is exposed to the fixative. And then you dab off the extra on the paper towel, and then it will be put on the slide rack for drying. So once it's dried and fixed, then the slide will be immersed in the solution 1. And as you can see, it's a slow dip for 10 seconds each and 3 times. And the extra solution is dabbed off. Then the solution 2, which is the basophilic stain, it's dipped for 5 times, 10 seconds each. The extra solution will be dabbed off on the paper towel. And then this will be immersed in the sterile water, quick rinse in the sterile water a couple of times to remove the extra stain, so there isn't like too much background staining and you cannot do the morphology assessment correctly. So now it's air dried. So we go on to the next step. So mounting of the smear can be done. You can read the slides, morphology slides, both mounted as well as unmounted, but It is an advantageous procedure because you can use these as internal quality control. You can have them stored long time in case you need to go back and review the slide. On the right side, there is the example of the cytoseal. So 2 to 3 small drops are placed in the center of the slide, which is stained, and then a cover slip is placed. It's important that the cover slip is positioned so the contact with the mounting media begins from the long side and no air bubbles get trapped. And then once the slide has been mounted, it is allowed to air dry for 30 minutes. Next slide. So how do we examine the smear quality? And it is done by bright field object microscopy. But the quality of the smear depends on several factors. It includes the volume of the sample, the viscosity, the concentration, the angle of the dragging slide. Smaller the angle, thinner the smear, speed of the smearing, quicker the movement, and then you'll have a good smear, nice feather smear. So initially, the best option is to start with a 10 microliter droplet at an angle of 45 for 1 second. On the right side is an image of a good stained smear, which shows the acrosome as pale lavender, the post-acrosome area as dark lavender, the midpiece is stained pink, and the tails are stained all the way very nicely. And the slide, in a high power is showing about 8 to 10 sperm, which is ideal. This is from the WHO 5th edition. Next slide. Preparation of a smear from another situation could be a viscous sample, which can be treated with the proteolytic enzyme chymotrypsin. And this sample is then incubated at 37 degrees for 30 minutes. And once it is liquefied, then it is ideal to prepare the smear. And it should not be done with a highly viscous sample because you'll get a thick, uneven smear and will not be able to do morphology correctly. Next. So morphological evaluation of a stained smear is done using a 100x objective. It is oil immersion. It's bright field objective. What is important is you need to do morphological evaluation of all the spermatozoa that are there in a high power field and sequentially assess all the spermatozoa. So this, if it is done, will avoid any bias or selection of particular spermatozoa. And it is important to understand the immersion oil as well as the glass slide and the mounting media all have the same refractive index. And this prevents refraction of light, and you will be able to assess the sperm morphology correctly. On the right, you can see a teaching microscope where the assessment is being done. Next slide. So here, continuing with the bright field microscopy, examining the stain quality under these optics, the head is stained pale blue or lavender, and in the acrosomal region, in the post-acrosomal, it is either dark blue or dark lavender. The midpiece shows some red staining. And if there is excessive residual cytoplasm around the midpiece, this also will be stained pink. On the right side, I provided an example from our own lab with the Defects staining, and you can appreciate how good the staining is with clear demarcation and clear differentiation of the spermatozoa. Next. So how do we assess the morphological normal spermatozoa? The normal form, both sperm head and tail must be normal. The sperm head is smooth, oval in shape. The acrosome is 40 to 70% of the head area, and no more than 2 vacuoles, and no vacuole in the post-acrosomal region. So on the right side, I've provided some practical hints for sperm morphology grading. And here we have to ensure that we are following the WHO 5th edition guidelines, and any sperm with borderline form or morphology will be classified as abnormal. This can be achieved by doing scoring and training sessions using a teaching microscope equipped with a video camera and a TV screen. Next slide, please. So the categories of sperm defects can be head defects, neck midpiece defects, or tail defects. The head, different forms, large, small, tapered, amorphous. Neck and midpiece defects, asymmetrical insertion, bent necks, thick or irregular midpiece, Tail defects, they could be multiple tails, they could be coil tails, or excessive residual cytoplasm is characterized as normal when it is more than 1/3 of the sperm head size. On the right side, some of the hints again, semen sample will contain spermatozoa with different abnormalities, and we have to be mindful about that. And these result from defective spermatogenesis or epididymal inflammation, where you could see a lot of pyriform shaped heads. And the same spermatozoa can have more than one abnormalities. And this is called mixed abnormalities within the same spermatozoa. Next slide. So training in sperm morphology is very important, as Dr. Henkel had talked about, correct assessment of sperm morphology. And to avoid a lot of lack of objectivity or not following the strict addition guidelines, we need to train the technologists to the highest level. And this is achieved by using teaching microscope, doing side-by-side morphology. And then we have the training document where both the trainee and the trainer will assess the same slide and then, assess if the trainee is doing well or if corrective action is required. Next. So the take-home message is from my talk that sperm morphology has been used for almost over 3 decades, and it is a key parameter in semen analysis, which is predictive of the fertilizing ability of the spermatozoa, as was reflected upon by Dr. Henkel as well. And the important step and the key is to follow the WHO 5th edition's guideline consistently. And how do we achieve this? By doing training, dedicated training in smear preparation, staining, evaluation, and making sure that the training is to the highest level for having precise and accurate results, and results which the clinicians can be confident of. And while we are doing the training, we also have to do ongoing quality control monitoring, and any type of error must be identified and then steps taken to mitigate or resolve the problems. Next slide. So this is our group in front of the Andrology Center with some of the ART trainees over 3 years ago. And thank you very much for your attention. Next. Thank you.
Thank you very much, Sajal, for an excellent presentation. Now we move to the second part of this lecture, which will be covered by Dr. Rakesh Sharma. Rakesh is an associate professor at the Lerner College of Medicine of Case Western. He is one of my associates here in andrology. He is the assistant technical supervisor of our andrology laboratory. We have 3 labs here in Cleveland Clinic. He has done a lot of research over the last 28 years since he has been working in Cleveland Clinic. And he is going to be speaking today. Let me move to the next. His presentation is a continuation of the first presentation, which started with Dr. Gupta. Now he's going to talk about the quality control in sperm morphology. Rakesh, you can begin.
Thank you, Dr. Agarwal. So I'm going to talk on the quality control in sperm morphology. Next slide, please. The learning objectives are the correct setup of the microscope and the quality of the stains, understand some of the possible causes of poor sperm quality, and understand the correct definition of strict criteria, look into some of the measurement techniques that can be used in correct identification of the sperm dimensions, and finally, the correct reporting of the results. Next slide, please. The microscope setup is very important, and the correct field, whether it is a bright field or phase contrast, should be correctly selected. And in case of sperm morphology, the bright field is used. We use an objective, which is a 100x objective, and a 10x eyepiece. The use of an ocular micrometer is very critical in sperm morphology. We cannot just look at the sperm and say if it is normal or abnormal. The micrometer is a small scale which can be inserted in the eyepiece, and it is specific to the make of the microscope, but it is easy. You can check with your vendor and they will be able to provide the correct reticle. It is simply a scale which has graduations, and each graduation is equal to 1 micrometer. Also, as Dr. Gupta mentioned, we need to use the correct refractive index of the immersion oil. The slides should be cleaned, and they can be cleaned with a lens cleaner solution, as well as using a lint-free wipes. A differential counter is also important for correctly categorizing the sperm either as normal or abnormal. Next slide, please. Sperm morphology remains one of the most controversial semen parameter. And as you heard in the first presentation by Professor Henkel, the categorization of sperm morphology is important because it has shown incorrect morphology can lead to a low predictive value, which is seen in the most recent publications, even though the sperm morphology in the earlier studies in the 80s and the 90s showed very strong predictive value with the ERT outcome. In addition, sperm morphology is very subjective. And what I mean by that is when we're looking at the sperm concentration or the sperm motility, it is easy to identify the correct concentration and the correct motility. However, if we are just using a visual assessment, it is very difficult to characterize the sperm either as normal or abnormal. So both the correct staining, as Dr. Gupta mentioned, the correct identification is very important. And there can be significant differences even among the technicians as well as the laboratories. And there are many problems which are associated with the preparation of the smear, the staining technique used, as well as the WHO criteria that is used to report the results of the morphological evaluation. And in our setting, we use the 5th edition, and we recommend that most of the labs do, and they should use the 5th edition of WHO for morphology assessment. Next slide, please. So some of the common stains that have been used over the years were the Papanicolaou stain, which was considered as the gold standard. And in addition, there was the Shorr stain. Both stains, they provide similar results. And the challenge with these stains is that they were very time consuming and involved many steps. And with the IVF labs and the laboratories, which required to report the results in a shorter turnaround time, these stains were not very suitable. And over the years, rapid stains were introduced, such as the Defects stain, which Dr. Gupta mentioned. And there was also another stain that was introduced, which is called the test simplets. And these were the pre-stained slides on which you could use a small drop of semen sample, and it did not involve the smearing of the sample, and it did not require any ear drying. Next slide, please. The test simplet was used mostly in the IVF labs, which did not have an andrology setup, and where the use of volatile reagents were prohibited. This slide shows the comparison of the 3 staining methods, the Papanicolaou, the Shorr, and the test simplets. And as you can see from here, the head defect, the mid-piece defects, and the tail defects were very similar when the slides were stained with Papanicolaou or with the Shorr stain. But if you look at the test simplet results, we see that this test simplets showed underscoring of the tail defects, as is clearly identified over here. And this shows that the test simplet is not a very effective method to stain the slides, and this method is not recommended by the WHO as well. Next slide, please. In this slide, I want to cover what are some of the quality control criteria that can be used to obtain good quality smears. As Dr. Gupta mentioned, the preparation of thin smear is very important, and this can be accomplished by using a smaller aliquot of the sample as well as making the smear at an angle of 45 degrees, and correctly following the steps of the staining protocol. In this case, we are using the Defects. And on to the right is an example of a good stain smear where you see clearly differentiated stains in the acrosome as well as in the post-acrosome region. Next slide, please. In this slide, I would like to highlight the definition of strict criteria, specifically when the slides are stained using Defects stain. The head length should be 5 to 6 micrometer. The head width should be 2.5 to 3.5 micrometer. The mid-piece should be 1.5 times or 7 to 10 micrometer, and the tail approximately 45 micrometer in length. There should be no neck, mid-piece, or tail defects. And in this case, all borderline forms are considered abnormal, and the normal value by strict criteria is 4% or more than 4% of normal forms. Next slide, please. In this slide, I will highlight the importance of using a micrometer. In the first image, you see a micrometer which has a crossbar with x-axis as well as y-axis showing 5 centimeter graduations, and each graduation is 1 micrometer. Each unit is 1 micrometer, and to examine the dimension of the sperm, we place the reticle on the sperm, and in this case, the second image on the y-axis, we can check the width of the sperm head. And in this case, the width is 3 micrometer. And the next slide, we place the reticle lengthwise so that we can measure the length on the x-axis. And in this example, the length is 5 micrometer. So this is an example of a normal sperm dimension. Next slide, please. Quality control is very important in sperm morphology assessment. And the quality control involves not only preparing a good smear, but also the stains, the quality of the stains that are used. And I would like to spend a few minutes to highlight the importance of the quality control in sperm morphology. It's very important to check the reagents, the stock reagents for the expiration dates. They should be current. It is also important to check the working stains and look for any contamination, a bacterial growth, or an oily film, which we observe in specifically the Defects solution 2. If there is a contamination or a bacterial growth, it is important to replace the stain, prepare a fresh stain, and the frequency of the stain depends on the volume of the slides that are used. If fewer slides are stained, the stains can be changed bi-weekly or monthly. And if the staining volume is high, it is recommended that the stains be changed weekly. On to the right is an example of how we monitor and document the quality control of the stains. We document the lot number of the fixative, the solution 1 or the solution 2, as well as the expiration date of each reagent. And below you see the dates on which the stains are replaced. So we can document very clearly and identify if there's an issue with the stain and troubleshoot where the problem occurred. Next slide, please. In addition, a quality control smear can be used to check the quality of the smear as well as the quality of the stain. And for this, a donor sperm can be used. The slides are air dried and they can be fixed, and Defects staining is used. And as you can see on the image to the right, the acrosomal staining is light lavender in color. The post-acrosome is dark lavender in color, and the tails show very good definition. And this is an example of a very good stained slide. If the staining is poor, it is recommended to repeat the smear and stain the slide and obtain a slide of optimal quality. Next slide, please. In the next few slides, I would like to highlight some of the causes of poor smear quality or poor staining quality. In scenario 1, what we encounter is that many times there may not be enough sperm on the smear. And some of the possible causes for this could be that the sample has a low sperm concentration, or the patient is oligozoospermic, so the concentration of the sample is less than 15 million, or the sample could be poorly prepared and the smear is not of the optimal quality. The solution for this is, as Dr. Gupta mentioned, we can concentrate the sample and we can make a fresh smear and stain it again. Next slide, please. This is an example where we find that the acrosomes are overstained. As you can see in the image to the right, the acrosome is overstained and we cannot differentiate the acrosome and the post-acrosome area. And this is because too much time was spent in the Defects stain 2. And the simple solution to avoid this is to reduce the time in Defects solution 2. And if necessary, we can give an additional wash in sterile water. So this is an example of a poor stained smear. Next slide, please. In many instances, we might encounter samples which have very high round cell concentration, as you can see in the image to the right. And this is because of the increased number of round cells that we encounter in some samples. The solution to this is we can dilute the sample if the concentration is normal and prepare fresh smears, and they will minimize the presence of round cells and make the scoring easier. Next slide, please. In some instances, we might find that the sample is viscous, as Dr. Gupta highlighted in her presentation, and this is also the reason why the smear may be difficult to prepare, or it might result in an uneven smear. And in such instances, we can make use of a proteolytic enzyme such as trypsin, liquefy the sample completely, and then proceed to make the smear and stain the sample. Next slide, please. In the last example, I would like to highlight sometimes we might end up with the smear which has overcrowding of the spermatozoa, as you can see on to the right. And this is because the sperm concentration in the original sample is very high, and we must avoid high concentration of the sample when making the smear. And this can be accomplished by diluting the sample with phosphate buffer saline, and depending on the concentration, we can use a 1:1 concentration or even a higher dilution to obtain good smear and a good stain slide. Next slide, please. Having seen the different causes of poor quality smear, once we score the sample in duplicate, how do we assess that these results are acceptable? In this scenario, I would like to give you an example that if we score the slide and we find the two readings for normal sperm are 18 and 9, the rounded average is 14%, and the difference between the two readings is 9%. So are these results acceptable? On to the right is a table from the WHO 2010 or the 5th edition, which shows that if the average difference is of 12 to 16%, then the acceptable difference in the two results should be less than 7%. And from our scenario, we find that the average is 14% and the difference is 9%. So the difference is higher than the acceptable difference, and therefore this result is not acceptable and the slide should be rescored. Next slide, please. This is another example where we find the two readings are 10 and 14%. So the average is 12% and the difference between the two readings is 4%. So are these results acceptable? So looking at the table on the right, for an average of 12 to 16, the acceptable difference is 7%. And since we have a difference of 4%, these results are acceptable, and then these results can be reported for the patient's morphology result. The take-home message from my talk is, number one, the microscope setup is very important, but equally important is the use of a micrometer for the accurate scoring of the normal sperm measurement. We cannot simply eyeball and say that the sperm is normal or abnormal. That will result in a big difference in the results. Also, the smear quality as well as the stain quality is important, and therefore the quality control is very critical. If we find that the smear or the stain is of poor quality, we must investigate and correct the cause of poor sperm quality, and we must have the results which are acceptable. And this is important when we're reporting the results for the patient sperm morphology. Next slide, please. This is a group from our staff as well as some interns. Next slide, please. And this is a view of Cleveland Clinic. And I would like to thank you for your attention to my presentation. Thank you very much.
Thank you very much, Rakesh, for your very nice presentation. This is our group at Cleveland Clinic in Andrology Center. And this is one of the images of the Cleveland Clinic. And you can connect with our program. We are posting daily our research activities, large number of research articles. You have free access to all these publications that we are offering. We are also sharing our latest research presented at ACRM, which is American Society for Reproductive Medicine, European Society for Human Reproduction, American Urological Association. Also, you can learn about our research opportunities and ART training, which are online ART training and opportunities to collaborate. You just have to find me on LinkedIn, Ashok Agarwal Cleveland Clinic, and you can send a request to join.